One type of skin injury is called bed sores, or also called decubitus ulcers. Bed sores are more common in elderly patients or people who are ill and not able to move around very well on their own. So typically people that are stuck in bed and not able to kind of adjust their body. So what happens when a bed sore forms is that constant long-term pressure on a bony part of the body pinches off blood flow to the area. And blood, the function of blood is to transport nutrients and oxygen to different parts of your body so that your tissues can make new tissues and deliver immune cells to the different areas. And so if blood flow is cut off to an area, the tissue that doesn't get the nutrients tends to die. So necrosis is the term used to indicate tissue death or cell death. So it's actually fairly simple to prevent bed sores. So someone who is bedridden, typically a caregiver will go in and adjust their body position fairly often. That helps to prevent the prolonged lack of blood flow to a certain area. That being said, if a caregiver is not able to do that very often, they are more likely to form. And these pictures here are some mild forms. They can actually get much, much worse. And in some elderly patients, it can lead to death because of the infection that settles into the area and the inability for the area to heal. Stretch marks are caused by the dermis stretching beyond its elasticity. So it's typically caused by rapid weight gain, and rapid weight gain can be associated with puberty because puberty is involved in, or it's a time when a lot of growth is happening. Also pregnancy, because the skin is stretching in order to accommodate the developing baby, and also just weight gain due to other factors such as overeating. As you can see here, the stretch mark that you're seeing is the kind of the underlying connective tissue, almost like a scar tissue. Calluses are another type of injury to the skin, and callus is your skin's way of trying to make additional layers of skin to protect an area. So they're caused by friction. So if you've got shoes that don't fit right, or if you are walking around barefoot a lot and your feet are experiencing a lot of friction, then the skin makes extra skin cells in the area to provide extra layers of protection. A corn is just a type of callus. It just takes on a slightly different shape. So corns and calluses are roughly the same thing.